Hi, y'all. I'm Jen Laws, CEO of Community Access National Network, and this is your third quarter 2023 HIV-HCV Co-Infection Watch. Since our last watch, the COVID-19 public health emergency has ended, beginning the unwinding process for many of the flexibilities in pandemic-era public health programs. A big note is the Medicaid unwinding. As of the time of this recording, more than 3 million people have been disenrolled from 35 states, with Texas leading the masses. The speed of disenrollment has sounded alarms within the Biden administration because states are required to take diligent efforts to help patients either remain enrolled, if qualified, or navigate securing other assistance like marketplace insurance. The vast majority of disenrollments have been procedural, meaning a patient has not had some form of contact with their state Medicaid program. It does not reflect any issue of eligibility. The speed of disenrollment is so concerning, CMS has issued stop orders to half a dozen states, with another dozen being monitored for intervention. States have been warned if they have an obligation to ensure sufficient efforts are being made to contact all affected patients and give them the chance to remain enrolled in Medicaid. States have been told if adequate efforts are not being made, their federal matching dollars may be at risk. Also in May, a debt ceiling deal was negotiated between legislators and the White House. That deal clawed back unspent dollars from the CDC, primarily affecting disease intervention specialists, or DIS, the backbone of public health work at the state and local level. This is really concerning because those are the jobs that were most affected by the pandemic, with people leaving positions that are critically necessary to keep filled. These jobs were also part of a promise President Biden made when coming into office, reinvesting and strengthening public health. It's important to note the dollars allocated for filling those positions take a significant amount of time to be realized. Between hiring processes, training, and so forth, it's not surprising many of those positions had not yet been filled after 2 years. However, what is unfortunate and meaningfully dangerous is rescinding funding for those positions and leaving them unfilled. Lastly, and this is a big one, a committee in the House has proposed appropriations that would gut giant chunks of funding to fight HIV, hepatitis C, sexually transmitted illnesses, teen pregnancy, and a whole host of other health initiatives, along with massive cuts to public education. The cuts don't stand a chance in the Senate, and the proposed appropriations are not likely to be realized. One representative characterized these cuts as mean-spirited, and with one of the proposals being elimination of the Ryan White dental program, it's hard to argue they're not. Most antiretrovirals require patients to eat around taking their medications, and people living with HIV deserve to have our teeth. But the nature of the policy writers in the bill are equally mean-spirited, modeled after some of the culture wars we've seen in certain states. So while these efforts are not likely to move forward, it is important for advocates and patients and the folks who care about us to pay close attention to what's happening in southern states. Extreme ideas gain legs when dismissed as someone else's problem, and leaving behind the region where more than 50% of new diagnoses occur and about 56% of the country's Black population lives is not only short-sighted in any effort to end the HIV epidemic, it's racist. And if that statement makes anyone watching uncomfortable, I invite y'all to sit with that discomfort for a bit. That's all for now. Be safe. Love y'all.